Previously spoken about iron deficiency anemia, but did you know that B12 and folate deficiency also cause anemia? The metabolism of B12 is more complicated than any other vitamin. I shared a post on my story today from Dr. Osborne talking about B12, so I thought I might take some time to talk to you about B12 deficiency today. In 2018, I was very unwell. I had symptoms of MS, multiple sclerosis. These are some of the symptoms that I was experiencing: headaches, brain fog, hot and cold sensations. My ear canals would pop open and stay open, particularly when it was hot. I had heat intolerance. The ear canal condition was called patulous eustachian tube. I had tinnitus, so ringing in the ears. I had paresthesia, which is like a tingling sensation, skin crawling sensation on my face, my nose, my hands, my legs, my feet. I had muscle spasms everywhere, like my eyes would just twitch. Muscle spasms in my arms, everywhere. Heart palpitations, which I guess is almost like a muscle spasm. I had back pain, rib pain. I had to wear a Holter monitor at one stage. And I had sores on my skin that wouldn't heal properly. Fatigue. I would see flashes of light, floaters, so like little blurry things in your eyes. Right-sided heaviness in my right arm and leg. Nerve pain in my teeth, fluid retention, frequent illnesses, so low immunity, a condition called proctalgia fugax, which is literally a pain in the ass. It's very, very painful. Like it's a muscle spasm as well. Word finding issues, memory issues, slurred speech. It was scary, very scary. So there was a particular day where I had a really bad headache. It felt like my brain had been scoured with steel wool. And I took the day off work. And then the next day I went into work. But when I was trying to answer the phone, I couldn't get the words out. My speech was slurred. I couldn't use a stapler. My head wasn't working properly. So I called my husband and he took me to emergency. They thought I was having a stroke. So they put me into resus, called the stroke team, flushed me with saline, and did some brain scans. And interestingly, the head neurologist said to me that my brain should have looked better for my age, that I had some atrophy, so some shrinkage of the brain that you would usually see in elderly people, not in a woman of my age. And I also had some lesions, some high signal scattered lesions in the white matter in the brain. So that can also present in cases of MS. So they released me, ruled out stroke, but referred me to a neurologist for further testing. While I was waiting for that neurology appointment, I made an appointment to see an integrative doctor. So an integrative doctor, if you don't know, is a doctor who focuses on root cause medicine. So they actually use different reference ranges when they're reviewing your blood test results, because they understand that sometimes the reference ranges on our blood tests are very broad, and there is optimal ranges. There's being in range but symptomatic, or there's being optimal. And so I got in to see this integrative doctor, and he said to me that my B12 level was below optimal, and he suggested that we replenish my B12 levels and see how I was. And if my symptoms didn't resolve, well, then I would just go and see that neurologist for further testing. But interestingly, I had amazing resolution in my symptoms very quickly as soon as he addressed that low levels of B12. And there's so much more to this, and I could talk about it for a very, very long time. But where I was at, I started researching myelin. Myelin is the nerve, the sheath that goes around your nerves. So this is why I had so many nerve symptoms in my body. So MS, multiple sclerosis, is an autoimmune disease where the body attacks the myelin sheath around the nerves. So this is why B12 deficiency and MS can look very similar, because B12 deficiency, or B12, vitamin B12, is necessary for the production of the myelin sheath. So you can have either an autoimmune condition where the body is attacking the myelin and destroying it, and obviously a condition like that would need B12 to help regenerate the myelin, or you might have just low levels of B12, so your body's not producing enough myelin. Now, I didn't know at the time. I mean, why was my myelin being destroyed in the first place? Why did I need to be replacing that myelin? Well, we did not know, but we had mold in our home, and there are certain exposures, certain infections that are demyelinating conditions, and mold can actually do that to your body. And I've heard stories of people who have lived in mold and needed B12 injections, and when they moved out of the moldy place, they no longer needed B12 shots. So it's just something to be mindful of. So I read a book when I was going through all of this. It was an amazing book. Could It Be B12? Written by a registered nurse called Sally Patchlock and co-authored by Jeffrey Stewart. That book was just such a wealth of information for me. Different things that can cause B12 deficiency. It's a long list, okay? So I already mentioned that it is the most complicated metabolism of any of the nutrients. But if you have low stomach acid, this is a huge cause, and as we age, our production of our stomach acid naturally declines. So our elderly population are obviously going to struggle with their B12 absorption. And so when you start to hear about what all the symptoms of a B12 deficiency are, these are things that we see in our elderly population. So you need sufficient stomach acid to produce pepsin, which is the enzyme that breaks down protein. So, I often think of all of the, the elements that come on in old age, and I think, surely these are just symptoms of malabsorption of our nutrients, because as we age, we are losing that stomach acid. Our pancreatic enzyme production is reducing as well. We're not breaking down our food properly. We're not producing, enough of the enzymes needed to metabolize and break down our food and absorb it. There's another infection. If you've ever had an infection called H. pylori in your gut, this infection is commonly linked to B12 deficiency. Gastritis, if you've ever had gastritis, that can actually damage the lining of the gut, where these little cells called parietal cells are located, and those parietal cells produce important enzymes for B12 absorption. Anyone who's had weight loss surgery, like a bypass surgery, there's, as already discussed, the stomach has very important cells in it that produce enzymes and factors, proteins that are needed for the absorption of B12. It could be malnutrition, and today we are seeing an increase in the amount of people following vegan, plant-based diets, vegetarian diets, partly, well, actually probably a lot of them are, because they think that they are helping to not only improve their own health, but the health of our planet. And so, unfortunately, the majority of foods rich in B12 are animal-based products. Which brings me to another point, because a B12 deficiency can actually increase your risk of stroke and heart disease. And if you've got a condition affecting your cardiovascular system, like high cholesterol, the doctor will say to cut down on your saturated fats. Well, saturated fats are found in animal food. So if people start cutting down on foods containing saturated fats, they're cutting down on their animal food consumption. They're also cutting down on their B12. And is it any wonder why they go on to have further cardiac problems, because there's a blood marker that you can test for called homocysteine. And homocysteine is a cardiotoxin. And as it increases, so does your risk of stroke and cardiovascular disease. And so when you see an elevated homocysteine, it can point, or it can highlight that there is an anemia in the body, that your body is not able to break that homocysteine down effectively. And that could be due to a number of different nutrients, but very strongly linked to that is deficiencies in B12 or folate. Alcoholism is another cause of B12 deficiency. Any kind of malabsorption, autoimmune syndrome like celiac, Crohn's, diverticulitis, SIBO, irritable bowel disease. You might have a genetic deficiency in the transporters. So it's one thing to have enough hydrochloric acid to break down your food. It's another thing to have a healthy gut with parietal cells that produce intrinsic factor to bind to that B12. But do you have enough transporters to take that B12 and transport it into your cells? There can be drug-induced B12 deficiency. Anyone who's taking antacids or proton pump inhibitors for, reflux, it's reducing the gastric acid, which is obviously then inhibiting the ability to break down our food properly and assimilate nutrients. H2 blockers are another cause of B12 deficiency, and very interestingly, we are seeing these prescribed a lot for people with histamine problems post-COVID. Metformin, used for diabetes, type 2 diabetes, inhibits B12 and folate absorption. You can look it up. Nitrous oxide anesthesia inhibits B12 absorption. Dilantin, epilepsy medications. Cholestyramine, which I believe is a cholesterol medication. Methotrexate, used for arthritis. Now, here's another story. I was running a market stall once selling essential oils, and had a client come to me looking for an essential oil for tingling, numbness, paresthesia. And I said to them, I'm such a bad salesperson, because I could have just sold them the essential oil and be done with it. But I said to them, you really need to get to the root cause. Otherwise, this essential oil is just a band-aid. Yes, it's going to improve your symptoms, but it's not treating the cause. Like, why do you have that tingling and burning? When did it come on? Has anything changed? And he said to me, I was having these horrible migraines. My doctor put me on a medication. And since I've been on that medication, I'm getting I'm having to take increasing doses of it, and I'm getting all this tingling and burning. So when we looked up that particular medication, which was actually a seizure medication, one of the side effects was the inhibition of B12. So I found this really interesting, because a B12 deficiency will actually cause headaches and migraines. And this particular person had headaches and migraines, so they went to their doctor, and the very drug that was prescribed to them to treat their headaches and migraines actually worsened an underlying B12 deficiency, which was the cause of the headaches and migraines. So this is one of the things that frustrates me beyond belief, is that sometimes a treatment for a symptom worsens the cause of the symptom, which was the case there. I said to him, go back to your doctor, get them to check your B12 levels, and he did. And he was so low that he had a series of injections, and what do you know? His headaches and migraines finally went away. The treatment he was taking for them wasn't fixing them. It did help initially, but then he started getting rebound headaches, and then he developed this new condition, which was the paresthesia, the tingling and the burning, the neuropathy, because his B12 levels were dropping lower and lower. Anyway, that's one of my pain points. So already I've talked about a lot of the symptoms: paresthesia, numbness, tingling, burning, fatigue, orthostatic hypertension. Where you change position and your blood pressure drops, tinnitus, ringing in the ears, shortness of tachycardia, which is a racing heart, enlarged liver or spleen, anorexia, loss of appetite, glossitis, sore tongue. The tongue gets swollen, and if you stick your tongue out, you can actually see crimping along the edges of the tongue, because the swollen tongue is pressing against the teeth and getting indents in it from the teeth. constipation or diarrhea, premature graying of the hair. It's not just limited to a B12 deficiency. Weakness of the arms, legs and body, balance problems, unsteady gait, falls, dizziness, visual disturbances, confusion, disorientation, forgetfulness, memory loss, dementia, disturbances in taste and smell. We're seeing a lot of this post-virally as well. Tremor, restless legs, nocturnal cramping in the arms and legs, muscular spasticity, abnormal reflexes, paralysis, including paralysis of the digestive system, which we're seeing post-virally, bladder and bowel incontinence, impotence, and then so many mental health issues are linked to B12 deficiency. Depression, anxiety, apathy, irritability, paranoia, mania, delusions, hallucinations, psychosis, personality changes, postpartum depression is also linked to B12 deficiency. And while we're talking about pregnancy, neural tube defects are also linked to B12 deficiency in pregnancy. And interestingly, we know that folate is prescribed during pregnancy because there is a known link between folate deficiency and neural tube defects, but excessive folic acid supplementation can mask a B12 deficiency. So if you are taking copious amounts of folic acid, which may not even be metabolized by your body, depending upon your genetics, if it's a synthetic folic acid, you're potentially masking a B12 deficiency, which could cause the condition in your unborn child that you are trying to prevent from the folic acid supplementation. Enlarged heart, left ventricular ejection fraction. So this is interesting because my eldest son, when he had really low B12 and iron and malabsorption, he had an enlarged heart, and it was an enlarged left ventricle, and his ejection fraction was reduced to 44%. So below 40 is considered heart failure. Now, when we replenished his B12 levels, what do you know? His ejection fraction increased back up to 66%. In infants, you might see B12 deficiency show up as a developmental delay, regression, seizures, failure to thrive, poor motor or socialization skills, language or speech delays. So how do you diagnose a B12 deficiency? Well, number one, it's important not to take B12, but actually, it can cause abnormal readings in your blood tests if you're taking it for even a couple of months before you have the blood test done. So it's really important to get your B12 checked before you start treatment, whether that treatment is injections or supplements. Get a full blood count, get a B12 panel including your active B12, because you might be able to absorb B12 from your food, but your body may not be able to convert it to its active form for absorption in the cells. You see, I told you, B12 is complicated. You need a full iron panel, folate, and homocysteine. But make sure you get copies of your blood test results, because the reference range is very broad, and doctors will just look at it and go, yep, you're within the reference range, you're fine, unless you're seeing an integrative doctor who understands optimal, because you want to be at the top end of that reference range. And say just off the bat, it's 150 to 700, you want to be up around 700. If you're under 300, you could be symptomatic, particularly if you have deficiencies in other nutrients that are also required to make myelin, which was the case for me. I actually, I looked up myelin regeneration, and I looked at all the other nutrients and cofactors involved for regenerating your myelin to help myself heal. And once I got a true understanding of how complex that production is and what's involved, I could see multiple areas that I was low in different factors and nutrients required. Often a doctor will look at a full blood panel or red blood cell count, and that will just look at the MCV, which stands for mean corpuscular volume, the size of the red blood cells, and that will rely on that to pick up a B12 deficiency. However, the MCV will start to increase as the size of the red blood cells are enlarging due to a, say, B12 or folate deficiency. But if you have an iron deficiency, the size of the blood cells decreases. So if you have a B12 or folate deficiency as well as an iron deficiency, your full blood count can look normal. Your MCV can look normal, as was the case with me. So you can't rely just on that full blood count and the MCV value alone. If the iron panel is indicating an iron deficiency, you won't pick up a B12 deficiency by looking at the MCV. So that is why it's really important to test B12 individually as well as active B12. Current treatment protocols are inadequate. This is another pet peeve of mine. Doctors will give a couple of injections and people feel immediate relief, but then that's it. But I mean, isn't it common sense that unless you have figured out what caused that B12 deficiency and you've addressed it, well, it's likely to recur, particularly if somebody has, pernicious anemia, an autoimmune condition, malabsorption condition, or a genetic condition that caused that B12 deficiency. The actual proper treatment is B12 injections, 7 of them taken every day or every second day. And then once you start getting symptom resolution, you stretch that out to every 2 weeks having a B12 shot. Well, some people are getting them monthly or 3 monthly. There's different types of B12. B12's proper name is cobalamin. There's 3 different types. So cyanocobalamin, cyano, think cyanide. It is the synthetic form of B12, which is commonly sold in Australia, and our bodies can't utilize it properly, particularly if you have certain predispositions genetically. So people with certain genetic SNPs, which maybe 40% of the population have, cannot use cyanocobalamin. And in actual fact, that will then be unmetabolized cobalamin in the body, which can cause all sorts of problems. So please avoid cyanocobalamin at all costs. If I see a supplement with cyanocobalamin, I would not touch it. Adenosylcobalamin. Actually, let me just come back to that. I saw a plant-based milk recently that I was very interested in trying, and it was fortified with B12, which is great for the vegans and vegetarians, but it was fortified with cyanocobalamin. So I wrote to the person that manufactures that milk, and I said to them, what are you doing? Like, if you're going to put B12 in your milk, please make sure it's a form that the majority of the population can metabolize and that is not synthetic. Another type of B12 is adenosylcobalamin, and then there's also hydroxycobalamin, and then there is methylcobalamin. And methylcobalamin is your active form of B12, although there's also some people with certain genetic predispositions that maybe don't do so great with the methylated form of B12, which is where hydroxycobalamin may be the better option. So I think if you're not sure what your genetic predisposition is, you're probably safer going for a hydroxycobalamin. Otherwise, I highly recommend just getting your genetics tested so that you know the best forms of B12 and folate to take. Because when it comes to B12 and correcting your B12 levels, cofactors are also important. So when you start to treat a B12 deficiency, whether that's with injections or supplements, and when it comes to supplements also, don't take a pill that you swallow into your gut, because if you have low hydrochloric acid, what makes you think you're going to be able to assimilate that nutrient? If you've got a problem with B12 absorption, it has to be either an injection or a melt, like a B12 melt, wrapping melt that goes under your tongue, or drops, or something that is absorbed through the mouth. Cofactors. When you start fixing a B12 deficiency, your body is going to make new red blood cells, and it needs nutrients to do that. What I saw personally is as soon as I started to correct my B12 deficiency, my iron plummeted, because you need iron to make red blood cells. So I would suggest the first thing to do is to replenish your iron levels. And one of the greatest ways I've found to do that is by taking desiccated beef liver capsules. Beef liver is a whole food that it actually contains all of the cofactors that we need to absorb iron. Sometimes people wonder why they can't absorb iron from iron infusions or iron from tablets when they're just taking a standalone iron supplement, and it's because they're deficient in a cofactor needed to absorb the iron. So beef liver will correct the iron levels. I've seen countless testimonials of people who did not find resolution with their iron deficiency anemia until they took beef liver. Get a desiccated organic grass-fed beef liver. Okay. Folate. This is a tricky one because if you haven't had your genetics run, you don't know which folate is best for you. Just like B12, there are different types. Folic acid is synthetic. Do some research into unmetabolized folic acid. It's not a good thing. You don't want to be taking folic acid. It is synthetic. Folinic acid is a better choice. It's an active form of folate and can be utilized by our body. And the other type of folate that is available is methylfolate, which, once again, depending upon your genetics, some people don't do so great with methylated vitamins. So that is where, even with the B12, you've got your methylcobalamin, and then your folate is methylfolate. They're the methylated forms. And then the next kind of type down would be your hydroxycobalamin or your folinic. And that's probably, if you don't know what your genetics are, maybe sit there. It might be just a little bit safer. Or do a combination, which is what I do. I take folinic capsules and I also take methylfolate drops. And what I love about the methylfolate drops is that I can just take one drop, which is 100 micrograms. I usually just take 2 or 3 drops. So 200 or 300 micrograms of methylfolate, and then I'll take a capsule of folinic acid maybe every couple of days, just to make sure that I'm getting a blend of the different types of folates which are suitable to my specific folate genetics. So I hope that helped. Yeah, B12 deficiency is, it's a huge subject and something that I'm extremely passionate about. Highly recommend that everybody test their B12 levels, gets copies of the blood test results, gets a copy of the Sally Patchalock book, Could It Be B12, and ensures that they have adequate levels of B12. I think if our aging population were all supplemented with B12 deficiency, we would see far less falls, dementia, cognitive decline. But yeah, one other thing I haven't mentioned in all of this discussion is that B12 deficiency can also cause subacute degeneration of the spinal cord. Back pain, get your B12 checked.